Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Tom, good to see you.
Parker, nice to see you again.
Always. Well, here we are. Welcome back to another episode of the Sit and Stay podcast brought to you by RipsyTech. I am joined by my co-host, as always, Dr. Tom Tarshis, founder and CEO of our company, Ripsy Technologies. Tom, what are we discussing today?
Yeah, we've been talking a lot of like little nuts and bolts things that were really specific for kind of people starting a new practice. And Parker, you had the great idea that why don't we branch off into something that could help people at any stage in their practice. And I thought that was a great idea. And so we're going to talk a little bit about, I guess, marketing would be the general category.
Yeah, well, if we want to talk marketing, I actually have a whole other episode planned specifically for that. But I mean, I think this is maybe a primer to marketing. I think the approach that we're going for here is a bit about, altogether, it's about, what are some strategies for building your client base. Marketing is absolutely, I think, a very crucial element of that. However, I think there are some questions that we have that maybe play into a little bit of, the types of relationship that you form with your patients, retaining your patients, encouraging, a healthy long-term relationship. So, with that said, maybe we should just go ahead and take it away. So, first question being, what are some of the most effective ways to attract the first clients to a new practice?
Yeah, great question. And just as a general comment, I think, the world is changing, and with social media and sort of presence of a lot of social media and other online presences in our society, it has, done something to how the mental health field operates. And we'll sort of talk about that throughout the podcast and various questions. With like historically, even when I was going through training in the early 2000s, there was this, from a psychoanalytic perspective, you really wanted to be a blank slate for your patients. And what that meant was you don't share much about yourself or your life. You if you see a patient in public, you sort of don't acknowledge them. And Right. It was like this very private relationship that, from the beginning, it wasn't something that really fit me and my personality. But I would say things have started changing. There's a lot of stuff written about self-disclosure of clinicians and people who work as therapists, psychologists, or psychiatrists. I think in general, it's a positive thing, especially in the field of child psychiatry. But it's still, because we are medical providers and a lot of what we do is HIPAA protected, it just put this extra asterisk around some of the pieces of marketing or social media or online presence. And we're just always want to be thoughtful about those pieces. So yeah, that disclaimer aside, unless that spurred any questions in your mind.
It spurred a few thoughts, but nothing too substantial. I think we could carry with the original question.
Gotcha. So how are you going to attract first clients to a new practice? So this is fitting in with our sort of helping new practices get set up. And I'd say what's, the number one way, which has not changed over the years, is going to be your personal network of people you've met during your training to become a mental health professional. So especially as you get near the ending stages of where you've been seeing patients and meeting colleagues, going a little bit extra when you're meeting a peer or colleague or classmates around building some relationships. And then when you're getting ready to start your practice, letting everyone know, hey, beginning May 1st, I'm seeing patients. And getting the word out to your personal network of colleagues is definitely the first step, because it is the mental health community in different areas tends to be small. So you let 15 of your colleagues know and they like you, they're going to spread that around. And that by itself, depending on the size of your practice you're building, could be enough to fill your practice. So that is number one.
Okay. What would be number two?
Yeah. So now this is a good question. If you are going to accept insurance or do accept insurance in your practice, this is going to be another way that's going to generate automatic referrals. So we've talked a lot about the pros and cons of different insurances. I think we even mentioned this possibly before. But getting on an insurance panel is a way to immediately get your name out there, and your name even just showing up extra on Google searches if you're attached to an insurance panel.
Right. And with what we've talked about in the past, especially with insurance companies, I think last episode we were talking about, if you're out of network and maybe you're looking for a single case agreement, the biggest thing that you suggested was having, somebody go, like a concerned parent or the patient themselves reach out to the insurance company and, make an argument for why they need to be seeing this specific provider. And one important step that seems to play a factor in that is really going through that list that the insurance company provides you. And we pointed out, a lot of those people that are on that list might not even be actively in practice anymore and might be a very outdated list. But if you can get on that list, then you will be reached out to by, some people. Yep,
exactly true. And there are big, we'll talk about them in a moment, but there are big companies that have gotten insurance contracts that make it very easy for you to sign up for a few hours a week. There's one called Monarch for therapists. There's Headway that does all levels of mental health providers. So that is another way to reach out. You're essentially seeing insurance patients, and these other companies are taking a cut of the profits in order to get you credentialed with insurances and get you those referrals. Which is not maybe great for your bottom line if someone else is taking a percentage of the proceeds. However, if you're getting started out and have hours you need to fill, you'd rather fill those hours for a lower rate than have them just empty.
Right. Yeah. A lot of these platforms, in a way, their big value proposition is that when they invest in their marketing, they're really investing in the providers that go through them as a platform. So it takes care of the marketing aspect for you in a sense.
Correct. Yeah. And then I'd say just sticking with we'll stick with the online methods first, because they are stuff that you can just do from your computer and a little less effort than getting out into the community. But looking at social media is definitely the way to get your name out. And I'd say the first thing that you should do is register your business as a Google business. So, the number one way people are finding their mental health professionals is a Google search. So go in there, it's if you're doing a virtual practice, it's maybe a little trickier about what address to put in, but if you sublease a space or have your own address, put that in as a Google business, put in your hours. You can put in that you're a mental health agency, and that immediately is going to start generating hits if you just register your business with Google. You can take that a step further and pay some money on keywords to get your name to show up. I think that's not something we're talking about on this episode, but
like a Google Ads type of approach.
Exactly. Yeah, you could do a Google Ads campaign. Again, often things like this are not necessarily needed for mental health clinics because the demand is so high. You don't really necessarily need to dump money into a Google search campaign.
Right. Yeah. I'm not a mental health provider, but just based on what I know, if I was starting a practice today, it would be, register my business through Google, Psychology Today, get myself listed, and Yelp. I think those are the three that I've personally noticed the most.
Yeah, and I think the Psychology Today is very well known, and it's a great referral source and something that when you're full that you can easily refer clients to. I am on Psychology Today. I think it's maybe $30, maybe even just $20 a month. Definitely have gotten some direct contact through the Psychology Today website that feels like it's been worth the money. It's also been a way to meet some peers or colleagues in the area. In addition, and maybe before Yelp, which I think we can talk about a little bit more, the pros and cons of Yelp, I think LinkedIn. So having your LinkedIn profile and then, connecting with other mental health professionals in your area is kind of a way to grow that, one step above your personal network. But those people you trained with, they're likely going to be on LinkedIn, and then you can connect with people who know them, and pretty easily if you can get several hundred connections on LinkedIn, and then that's a great platform to announce that you've opened your practice or are taking new patients. And I think because LinkedIn is really meant for colleagues and not really patients, even though it's a way to let 1 in 3 adults, 1 in 4 kids need a mental health provider. So people who are your colleagues will still need mental health providers. But because it's a platform for professionals, I think it feels a little safer than some of the other social media platforms.
That makes sense.
Yeah, such as Facebook. However, Facebook has some great groups designated for professionals that can be really a great way to get the word out. So there's national groups for psychiatrists, psychologists, social workers, marriage and family counselors. There's local groups. Find the group that's well run, that kind of screens that your mental health professionals will be in there. And then, it's a great way to announce that your practice has started as well.
You already answered my next question, which was, how can networking with other providers influence your growth influence your client base growth? Now, is it that doing that will provide you with a source for referrals, or getting, like, if somebody needs to refer a patient to somebody who specializes in something, is that a good way to get your name out there as somebody who specializes in something? Like, what is the gross benefit of other providers knowing that you exist?
Yeah, no, great question. I think the main piece is that good providers who've been established for a while often no longer have room for patients. So if a provider gets some phone calls, or a current patient says, "Hey, my friend needs to see someone," if you're full as that provider, but that a colleague has just announced that they're opening a practice, that can immediately result in a referral to that new practice. If you do have some specialties, for example, if you're really good at doing treatment for obsessive compulsive disorder and really love those patients, getting the word out that you like patients with a certain diagnosis or who need a certain treatment that other providers are less excited about, That's a great way to get those referrals. And same thing with age groups. If you work with very young or very old or teenagers, letting people know that those are the patients you want, it's a great resource then if other providers know that and can send people who meet that your way.
Okay, I mean that makes a lot of sense. We're talking a lot about things that you can do online and profiles that you can create on different websites. What about creating your own website? At what point as a provider do you need to make that leap to creating your own website?
Oh, and yeah, good question. And so I feel like everyone knows to do that without it being said, but maybe that's not true. I think right along with getting your business license, you should be grabbing a domain name, and there's some great platforms that make it very easy to design your website now. But you definitely want to get your website up there. There's a lot of differing opinions about what to put on your website, but we know that people like to see photos. So I understand people are not always comfortable putting photos up, but there is market research that says if you put a nice photo up, you're more likely to get someone to give you a call than if you don't have a photo. I think we maybe hit on the topic of, do you put your rates up? Do you put how much you charge? If you take insurance, do you give people a super bill?
Right.
That's all highly variable in the mental health field. Just to jump to the Yelp topic, and it's a little relevant for once you're on Google Maps also, because people can leave Google reviews.
Right.
We're because of HIPAA, if you receive a bad review through Google reviews or through Yelp, it sometimes puts you in an awkward situation on how to respond to that review, because you can't really write back and say, this person refused to pay me and got angry when I asked for payment and then said I was a terrible provider. It's a complete lie. Like, you can't disclose.
Right.
They can write whatever they want about you, but the normal response to the different platforms when you have a unpopular review is, sorry you had a bad experience. Can't disclose anything due to confidentiality reasons. So that brings up, and we all know that people are more likely to leave a negative review unprompted versus a random positive review. So, what are the ethics around if you've been working with a patient or family and done very well? And I'm not saying I know the answer to this question, but, can you ask your patients to leave a nice review for you? I think it's very clean for, like, my dental provider. They're always saying, we love reviews. Please review us. Get a $10 off coupon if you do a review. They're also bound by HIPAA and confidentiality laws, but, it feels like there's something different between a dental practice and a mental health practice.
Right. One of them is just, the quality of my mouth. And then the other one, the other one is almost kind of speaking to, like, there's such a stigma, I guess, around mental health that it's hard to feel willing to put yourself out there and say, hey, I want to say my therapist is great and admit to the whole world that I go to therapy. And, there's, for some people that may not be a problem. For other people that might be, of concern because of the stigma that still exists. So
yeah, and we're doing better on the stigma, thanks a lot to teenagers and younger generations. But as you said, it's still something that's not totally comfortable for everyone. Maybe we'll get there someday. So, is it okay to ask a satisfied patient to leave a positive review for you on Yelp or Google reviews? I definitely think in certain circumstances that is okay. Um, it's a, I think it's especially clean if someone is better and kind of graduating and has had a good experience with your treatment to say, hey, you're under no obligation, but we're finishing our time together. And yeah, if you'd like to put a review up on Yelp or Google reviews, that would be awesome. I think it's very tricky to ask a current patient to do that because
Right.
they're going to think, oh, what if I don't leave a great review? Is my provider going to play mind games with me or, not be as happy to see me? And
Right. That was the first place my head went when you brought it up.
yeah.
Yeah. I
And
mean,
so
that actually, oh, go ahead.
no, go ahead, Parker.
I mean, that actually makes a lot of sense because when you think about a service that somebody is providing you, and that's what these reviews are for. It's the whole experience of what it was like to be a consumer of whatever this thing was. And I guess when you operationalize like what are you getting from a therapist when you are graduating from therapy, that is kind of like a way of saying you've gone through like the whole course of what this person had to offer you. And that's rather than being like, if I reviewed a movie halfway through the movie, that wouldn't be, indicative of what the full experience of that movie was. So that's just the thought that popped into my head when you brought that up. Of, that is kind of an ideal user group to be leaving you a review, as somebody who is, graduated, as you put it.
Yeah, I would say that there are some cleaner feedback methods. And for example, you can give a kind of a customer satisfaction survey with like your intake process. How did that go?
Right.
And you can kind of put that on your own website. Like, here's some things my clients say about me. You can ask people, if you've got a large enough group, or you can easily set up leave an anonymous review on your website where you could ask people to leave anonymous reviews, and you could take those and put them on your website as well. So there are some ways to get anonymous information about how you're doing as a provider and get that information out there. But that's my comment on. And certainly, if you are working hard for your patients and doing a good job, we are in this culture where reviews are more common. So
Right.
lots of times you would just be pleasantly surprised that you'll see a patient will put a good review up there and maybe use their initials or a pseudonym or just put their full name out there. And that's always a nice feeling.
We keep answering my next questions before we answer them, which is fantastic. I guess I wrote some good naturally progressing questions here, but the next one was, what role does patient satisfaction play in expanding your client base? We've talked a lot about, reviews. If you're getting positive reviews, then your patients must be satisfied. Are there other ways to optimize patient satisfaction for the purpose of, increasing the, notoriety or just, just expanding your client base?
Yeah. And I have a lot more content for the previous question as well. With other healthcare providers, but this is a good one to hit on the patient satisfaction. And it is true that if your patients like you and they're getting better, that is the key to a successful business, right? You're a service provider. You don't have a product. Your product is the service you're providing. If you do a good job providing that service, that's how you're going to build your business. Our field is tricky because even you can sometimes maybe not be doing a great job with the service you provide, but be a nice person, and it still can be good for your business just because you're a nice person. Mm-hmm. But the reality is that because mental health issues are so prevalent in our society, if you're treating 40 patients and you're doing a great job with them, again, 1 out of 3 adults, 1 out of 4 kids could use mental health services. So they're going to let their peer, one of their friends, colleagues is going to say, oh, I'm really depressed. Hey, you should go see so-and-so. They've really helped me. That's just going to be a natural growth pattern if you provide a good service. Other ways to make sure, and I think this is a problem in our field, that we don't do enough check-ins on how our patients are doing and how the sessions are going. And I think this is something else that I think we're evolving to do better, but because there was this kind of secrecy or what goes on behind the closed door in the therapist's office that was in this field for so many years, it's taken us longer to be really checking in on how our patients are doing. And so that's why I've always been a big fan of outcomes measures, and we built it into Ripsy to be non-burdensome and easy. But you've got to really, I think, even do more than a verbal check-in and really have patients write down both how they're doing with the reason they came into therapy at first, and then also being direct in asking how am I doing as a provider? How are you satisfied with your treatment? What can I do better? You can always do things better. And clinics and practices need to be a little bit more fine-tuned to be getting that regular feedback from their patients. Again, in general, your patients build a relationship with you, and if you're a kind person, they may not want to say, hey, I'm just as depressed or I'm worse, even though I've been coming to see you for 7 months. And so just because they kind of show up and smile and participate, they might not be getting better, and they might be embarrassed about bringing up that they're not feeling better. And so we as providers have to do a better job of making sure that that's happening.
Well said. Well said. Okay. Do you want to run it back to the healthcare provider network? It sounded like you had more you wanted to say on that subject.
Yeah, and I'm wondering. I know we're being mindful of our time. I don't know if we can cover everything, but we can always do a part 2 on this topic. But we talked a lot about sort of online stuff that you can do, but as you get started, there are good old-fashioned in-person things to do, and some of those involve seeking out some of your other healthcare providers. Every discipline has local branches that get together for meetings. So there's regional branches of psychiatrists, child psychiatrists, psychologists, social workers, marriage and family therapists, and they all tend to have monthly or bi-monthly meetings depending on the groups. In the Bay Area here, there are lots of meetings by colleagues, and making sure that you're connected with the national group for the discipline that you're in, that then filters down to your local group. Going to those meetings, introducing yourself to some of the more senior people, bringing a flyer about your practice, letting people know that you've opened up a new practice. That is a great way to get the word out. When you're getting started, or if you've been in existence. In addition, crossing, going interdisciplinary. So if you're a psychiatrist, asking to go to the local marriage and family therapist meeting and introduce yourself and maybe give a talk on something relevant. Or if you're a psychologist, seeing when the next child psychiatrist meeting is, to go out there and talk about services you provide or how you can be a resource. It's a great way to and we all know meeting face to face and shaking someone's hand and seeing them in person, that's going to make more of an impact
Absolutely.
than online interactions. So I'm really a big fan of getting out there, meeting people in the community, and that's how to get your name out among other healthcare providers as well. stepping out from the mental health providers, there is a whole other world of healthcare providers that are often asked about mental health questions, and that's primary care providers in the community. So especially if you work with children, local pediatric groups, making a good impression on a local pediatric group, if you see kids, can give you more patients than you know what to do with. So again, like reaching out to local pediatric or primary care groups in your neighborhood, letting them know you're a mental health professional and here's who you see. I'd say the one asterisk here to be mindful of is most primary care providers take insurance. So if you are a cash-based practice, in addition, though, most pediatricians and other primary care providers know that most mental health professionals do not take insurance. So just being aware of, opening a practice, what your rates are if you're not taking insurance, will you submit to insurance for people even if you don't take insurance? Just to be aware of that insurance question comes up when you go to non-mental health providers in the community. But it's still a great way to build up your practice because primary care providers are the number one, top type of provider that finds out first about mental health issues as healthcare providers.
Right. And so what other forms of community involvement can you get into to, help build your client base?
Yeah. So this is can be a fun question, and there are lots of more ways in the community to get involved. I'll say, let me list some off that we've done in the past. We talked about primary care providers being the number one healthcare provider that finds out about mental health issues. But the reality is that school settings, so elementary, middle, high schools, and college settings, get lots of requests or notice when there's a lot of mental health problems happening. So letting the school districts or individual schools, we'll talk about, let me start with colleges first. But most colleges have a student health center, letting the colleges know that you've started a practice, who you're seeing, what your rates are, going to give a talk or meeting the people at the local college student health center. And most colleges even have a square where in the fall, they'll run health fairs, signing up to do a free depression screening, and go there with some. We've had great success going to campuses with our iPads, have people do a little questionnaire, talk about it.
Yep. We did do that. That was fun.
And so that can be fun and a great way to go directly to people that might need help. It gets a little trickier for the public school system because there's paranoia around if a school or a teacher says this kid needs mental health services, that then the school district is going to need to pay for it, which has truth to it. So the strategy there is more, we've given talks to the mental health professionals at school districts. We've given talks for parent-teacher associations. We've given talks on normal development at high schools. So you reach out to the parents, PTA groups, offer special education nights and sort of get your name out there in those settings for some of the lower grade school, elementary, middle, and high schools. And then you've got community healthcare events. So we just had a neighborhood event in the Elmwood region of Berkeley, and there were dentists out there, and there were some other businesses out there. We've done this before. It's a fun way to give out a squeezy stress ball and let people know, hey, we just opened up nearby and we're cool and come see us. There are bigger healthcare events that happen. So looking both in neighborhood, city, and county and seeing what's happening in your area and it's often free to just set up a booth there and get your name out. And I know I'm blazing lots of information here, but I'll say the final
it's good stuff.
The final one we've done is, and especially here in Silicon Valley, but large companies tend to have events for their employees.
Mm-hmm.
So even and we're not even talking, Facebook or Apple or that size, but companies that have 50 or 75 or 100 employees, they're often very happy to have a mental health professional come in and, again, do a free screening. We've done things where we've brought our espresso machine to say hi to different employees and offer a screening, and just, a workplace that may not have someone come up and say they're in really bad shape and need help because they're worried their boss is listening, but they may come up and say hi, and then you might get a phone call a few days later, like wanting to engage in services. So I think I've covered most. As you can see, there are
many ways.
Many ways, and a lot of them are very fun. And so, hopefully that's helpful, and you can sort of pick the things that make you feel the least anxious to go out and. Even though we treat anxiety, it still can be anxiety provoking for all of us to go out and do these events.
Yeah, no, absolutely. So my last question here, this could be an interesting discussion point, but what strategies can practices use to retain their clients and encourage long-term relationships?
Great question, right? And so the goal as a provider is you want your patients to have a good experience and ultimately get better. Now there's, this is maybe me speaking personally, but we, I have my public health degree and I'm very public health focused. And the only way we can make an impact on the mental health crisis in this country is if we kind of treat people and get them better in 6 to 12 months and then have a spot to treat someone else. Mm-hmm. There are certain diagnoses that it's not a 6 or 12 month and you're better situation. And so we know when there's those more severe diagnoses, and I'm not talking about those cases, but I'm talking about someone coming in with mild to moderate depression or anxiety, attentional issues, relationship issues. This does create on some level, this may not mix with the perfect business practice, because if you get your schedule filled and have clients coming in who pay properly, you're potentially set from a business perspective. And consciously or not, you might be disincentivized to get someone better, graduate them from treatment, and bring in another, what may turn out to be a more difficult case. But nevertheless, the way to build your reputation as a good business is to do a good job with your patients, so that I think every one patient you have that you treat for 6 or 12 months and gets better and has a good experience, they're going to be sending you 5 or 10 more people because they've had a good experience with you. Right. And that is going to be the way to get the long-term relationship. I think is not directly from individual patients as patients, but it's doing a good job with a patient so that they'll always remember when they have a friend or family member that needs help, they're going to send people your way. And that's how you're still retaining that client, even if they're no longer a paying client for your company.
Very well said. Very well said. This made me think about an interaction I had with my own therapist recently, where I usually tend to like to meet with him weekly, but the last time we were scheduling, he said, we could meet every 2 weeks if you want. We're doing good. We could meet every 2 weeks, and that stood out to me so much as as somebody who works in this business. I'm like, oh. He's not just trying to take my business. He actually cares and thinks I could see him less. And even though he's not going to get as much money from that, he's he's being genuine and telling me like, we could meet less frequently. And that to me, I think is, indicative of a good service being provided.
Yeah. No, great comment. And I would say there is a whole other, sidebar conversation to this, which is, we live in a world that has a lot of luxuries like fine wines, nice dinners, vacations, Disneyland. And for example, if you really love going to therapy, even if, quote, you maybe don't meet any criteria for a diagnosis and your functioning is pretty well, should you still be allowed to go see your therapist every week, sort of as a luxury or something you're treating yourself to, like a massage or a pedicure? Is this another item that is okay to continue with that? And I'm not going to claim to know the answer to that. I think for myself as a clinician, when someone's getting better, it also tends to not be as satisfying as a provider to and I work with a lot of kids and try to make it fun. And there's a lot of kids who would keep coming and we could just keep playing some video games and chatting and right. But for me, if we're not actively working on problems, it becomes less intellectually stimulating. But I will say that I know lots of people that treat their time in therapy like a luxury item they've earned and they deserve. And yeah, I don't necessarily think there are lots of different opinions on that. From a public health perspective, it's maybe not great, but from this is the world and there are luxury items, and can therapy be a continued self-improvement, be a luxury item? That's a reasonable discussion.
Yeah, I mean, I guess for myself, I'm young. I mean, I'm only 30, but I feel, which I don't feel that young anymore, but I do feel young enough to have grown up in a generation to view it as this it's just something to be proactive about. I guess I could definitely describe it as a bit of a luxury. It's something that I think a lot of the exposure for me when I was a young adult was that we want to treat our mental health problems just like we would with our physical problems. So you want to have regular checkups with your doctor. I view it as you want to have regular checkups with a therapist. Granted, I'm not always going to therapy weekly. Sometimes it's just nice to have, but anyway, I guess I'm just snapping my fingers and in agreement with everything that you're saying.
Yeah, no, and but you did bring up a good point, which is I have lots of patients over the last 18 years that have gotten better, but have reached out, hey, can we have a session? And you're always, when you terminate, you're not like, I'll never see you again, have a nice life. It's, how to reach me if something comes up. And being a resource and checking in if someone, it's great that you have that mindset, and we could probably all do with that sort of direct check-in for our mental well-being.
Yeah. It helps to have studied psychology for the last 10 years, so I just can't help it. All right, well, great. So we're going. Well, we're a little bit longer than we expected to today, but do we have any mental health business moments this week?
Yeah, there are lots. I think I'll talk about
I see you pondering.
Yeah. There's a lot of, I think the one that has caused some extra aggravation this week was in our online payment world, where we work to accept all sorts of online payments. The reality is that some sometimes you get, right, when things have been working perfectly and you have people who've paid through your online payment manager before, they just haven't been able to be successful and have said, I've tried multiple different credit cards, and even though other people have been paying, you're to the point where a patient's like, can we send you a check? Which of course people can, but just having to spend like this extra time and energy for something that usually goes very smoothly has been frustrating this week. I'll just leave it at that.
Well, very understandable. Very understandable.
Yeah.
Are you still there? I
am still here. We did
okay.
freeze for a moment.
Brief glitch. First time that's happened. We've had pretty good success not having that, given we are meeting virtually. Anyway, anything that you'd like to add to that, or?
Yeah, no, I think I'll be able to give more specifics later when I figure out what's been going on. But it's just you have a smooth setup rolling with collecting payments, and then all of a sudden to have a frustrated client, because I know that they're trying hard to pay, and then not being clear where the breakage is, and that taking up extra time.
Right.
That's the sort of thing you just have to, and it could just be, right, sometimes technology fails for a while and then starts reworking, and we never know the answer. So we shall see.
Right. Yeah. I had my own experience with that this week as well. And sometimes it's out of your control.
Very true.
All right. Well, great. I think this was a great episode. Thank you for listening to the Sit and Stay podcast this week. Be sure to, check out our blog on our website. Be sure to like this if you're watching on YouTube. Follow us, leave a review. And if you have any questions that you would like to be answered on the podcast, go ahead and submit those to sitandstay@RipsyTech.com.
Very cool.
Awesome. Well, I'll catch you next time, Tom.
Thanks, Parker. See you soon.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.